COVID-19 can be characterized as
declared a public health
untuk melaksanakan perintah kawalan pergerakan.
Negara akan memasuki fasa peralihan ke endemik.
Coronavirus disease 2019 is a highly contagious viral illness caused by severe acute respiratory syndrome SARS-CoV-2. It has had a devastating effect on the world demographics, resulting in more than 5.3 million deaths worldwide. It has emerged as the most consequential global health crisis since the era of the influenza pandemic in 1918. After the first cases of this predominantly respiratory viral illness were first reported in Wuhan, China. In late December 2019, COVID-19 rapidly disseminated across the world in a short span of time, compelling the World Health Organization (WHO) to declare it as a global pandemic on March 11, 2020. The endemic phase arrived this year after a 2-year battle with COVID-19. The socio-economic situation in this country is steadily improving and reverting to pre-crisis levels. This is because Malaysia has established a herd immunity in terms of vaccination. However, you need to know that the vaccine is not a substance that fully prevents COVID-19 from the body. Vaccines do not prevent infection, but they do reduce the intensity of COVID-19 symptoms. This does not apply to patients who do not have chronic illness at the time of immunization. People will eventually get chronic diseases as time passes. Those with underlying medical conditions like cardiovascular disease, diabetes, chronic respiratory disease, or cancer are more likely to develop more serious illness. As a result, the risk of fatality rises. Hence, preventing the infection from spreading further is critical. Moreover, people must labor during an endemic. It is difficult to quarantine and monitor their health status because they are also dedicated to their jobs. Thus, a system that monitors and notifies patients' health status to the health personnel while they can continue to work normally is required. This problem can be solved by utilizing the responsive COVID-19 patient monitoring system Rescom, which we developed. We created a management system to address the issue by monitors and notifies COVID-19 patient data in a more detailed and effective manner around the clock. The patient will be provided a device that contains 3 types of sensors that detect SpO2, heart rate, and blood pressure. The patient wears the device on his or her wrist, and the data is transmitted to the server via IoT. After that, the data will be processed by an artificial intelligence that we created. The AI will forecast the patient's health status while also doing data-driven decision-making to select the best treatment option for the patient. A monitoring unit will be set up in a nearby hospital to keep an eye on any anomalies and dispatch medical assets to the patient as needed. The server will notify the assets, which will then reach the patient. This is the main dashboard that will be used by the monitoring unit. As you can see, there is a map of Kulim and a summary of the current total monitored cases of COVID-19, as well as notifications that will notify you if an emergency or anomaly occurs. This section then displays the total number of assets that are currently available. At the bottom, there are 3 graphs that will provide a live feed of the average data from all of the patients who have been monitored. Aside from displaying the location of the patient, the map can also show detailed individual data by clicking this icon. This is where the monitoring unit can review their biodata, individual recorded data, and treatment options that the machine learning program has recommended. Prevention is always better than cure. More deaths may result from ineffective management. We hope that by implementing Rescom, our management system will improve, and as a result, all patients will be safer. That's all from us. Thank you.